Welcome in to Your Health, and we have back with us this week Dr. Donovan Kendrick is the Chief Medical Officer for the Baptist Health System, and we're going to talk more. We talked last week about COVID, about getting the vaccinations. We're going to talk today a little bit more about your behavior, how you protect yourself and others. You just share with us because you're the expert.
You know, one of the things that we know for certain is that behavior makes a difference. We've seen it after every single holiday, a spike in cases, after the 4th of July, after Labor Day, and now after Christmas and New Year's, we've set record numbers in our hospitals because people ignored the advice to stay at home, stay away from people that are outside your immediate household, wear the mask, social distancing, and so forth. And we have paid the price for it. We have hit record numbers that we haven't seen since this pandemic began because people ignored advice over the holidays. Now, it takes more than just social distancing and quote, wear a mask. You need to wear it right. I see people all the time with it pulled down below their nose. You might as well not wear a mask, because the virus lives in your nasopharynx, your nose and the back part of your throat.
Okay.
When we swab people, we test people, where does the swab go? Up their nose, not in your mouth. And so not only is it not protecting you to wear it under your nose, it's not protecting other people if you happen to have it. And you may be spreading it to other people because you're not wearing your mask correctly. And I've asked a lot of people, well, why aren't you wearing your mask above your nose? And I've heard things like, oh, I can't breathe, it fogs up my lenses, it's too hot. And most of the people that are telling me that are wearing cloth masks, which do work if it's a double layer of cloth, but they are heavier and sometimes they just kind of fall down off your nose when you're trying to talk. They're thicker, so it is probably a little harder to breathe. What I recommend for everybody is wear a mask like I have on. These masks are available at drugstores for like 75 cents a piece. You could get a handful of them, and they have a little wire on the top that you can conform to your nose that does help prevent fogging of your glasses. However, I've done this for many years in surgery. I wear a mask like this and using a microscope. And to keep the microscope lenses from fogging, I would put a little piece of tape across the top, stuck to my skin. It does need to be a paper medical tape like you would use for bandages so that you don't pull your skin off, but it works perfectly. And then one other thing that might work is if you take a Kleenex and roll it up and put it across your nose and then pull the mask over that, that can also prevent your lenses from fogging if you're wearing glasses. But for everyone, there is no point of having a mask on if you're going to pull it down below your nose. And then one other thing that we have found, some masks, cloth masks, commercially made, have what they call respirators. They're little holes, they're little things.
I've seen those. I've seen those.
We don't know that those filter the virus. So you could still be spreading the virus. So what we did at Baptist Health when all this started is if someone had a respirator in their mask, we made them cover it with tape to make certain that they weren't spreading the virus to other people.
Wow.
Social distancing is still important. I know everybody wants to get back to church and wants to go see their kids and so forth, but it's dangerous. And we still need to stay apart from people as much as we can, unless it's absolutely necessary. I live out in the country. Nobody delivers groceries. I have to go to the grocery store once a week, but I make certain that I get enough that I only have to go once a week. So there are things people can do to keep themselves safe, and it's imperative we do that if we want this to ever end.
I have a question. Let's talk about who is at high risk. What people out there need to be super conscientious.
The Alabama Department of Public Health has stratified who gets the vaccine based on the highest risk individuals And so they started with frontline health workers, people who are at the bedside taking care of COVID patients and so forth. So those people are at risk. Secondly, then, and just this week, have moved it to include people over 75, because people over 75, a lot of them have pre-existing conditions, heart disease and so forth, lung disease, so they're at risk as well. And now they're eligible to get the vaccine. And then last, just again recently, first responders, policemen and firemen, because they don't know what they're getting into when they go and try to save a life. And so those people are all at risk, but a lot of people think this is something that if you're older you have to worry about. There are teenagers that have died. There are people in their 20s and 30s that have died from this. It doesn't mean that if you get it just because you're young, you can ignore the things that we've already talked about. And I see that an awful lot with college kids and so forth. They think, oh, I don't have to worry about it. Even if I get it, it's not that big a deal. But there have been some of those that have died. So it's important for everybody to do this.
Well, you made another good point last week. If, you know, there are a lot of people who have already had it, but that doesn't mean that they can't have it but not be sick, but still spread it. So our behavior needs to stay as it is.
Right.
Okay.
Exactly.
All right. Well, listen, thank you so much. And you've cleared up a lot of things for a lot of people. And I can hardly say this without crying, but God bless all of you. I know you are exhausted and stretched thin. And if you want to help your health care providers, then you take care of yourself, do the right things, and protect yourself and everybody else. And thank you so much, Dr. Kendrick.
Absolutely.
Thank you.
Sure.
And stay with us, and we'll be right back.